Scene script. Have you ever heard of cutaneous leishmaniasis? A term that might sound a bit intimidating, but today we aim to demystify it. Cutaneous leishmaniasis is a type of skin infection that occurs due to a parasite called leishmania. This parasite is transmitted by the bite of infected sandflies, tiny blood-sucking insects that are merely 2 to 3 millimeters in size. Now you might wonder what makes leishmaniasis noteworthy. This disease, which is more common in tropical and subtropical regions, affects over 1 million people annually. The symptoms of leishmaniasis may vary depending on the type. In the case of cutaneous leishmaniasis, the most common form of the disease, symptoms often include skin sores, which erupt weeks to months after the person gets bitten by the infected sandfly. These sores can be painless or painful. Some people may have lymph nodes near the sores that are swollen. Diagnosing leishmaniasis involves taking a sample from the sores and testing it for the parasite. If the disease has spread to the internal organs, a blood test or a tissue biopsy may be required. Images of leishmaniasis show a spectrum of skin manifestations. The sores, usually on exposed areas of the body, can start as papules or small bumps and can grow over time into larger ulcers. They may be covered by scab or crust. So how do we treat leishmaniasis? Well, the treatment depends on the form of the disease. Cutaneous leishmaniasis might heal on its own, leaving behind noticeable scars. However, health experts often recommend treatment to speed up recovery and to prevent complications. Treatment options may include medications, heat therapy, or cryotherapy. In severe cases where the disease has spread to the internal organs, known as visceral leishmaniasis, antiparasitic drugs are used. These drugs can be administered orally or through an injection. Prevention, as we know, is always better than a cure. Preventing leishmaniasis involves protection from sandfly bites. This can be achieved by wearing long-sleeved clothing and using insect repellent, especially from dusk to dawn when sandflies are most active. To encapsulate, cutaneous leishmaniasis is a skin disease caused by a parasite transmitted by sandflies. Symptoms often include skin sores, and the disease can be diagnosed using samples from these sores. Treatment varies depending on the severity of the disease, and prevention is centered around protection from sandfly bites. Remember, staying informed and vigilant is the first step towards prevention. Stay safe, stay healthy.